All right, today we're going behind the front lines of a microscopic war. We're talking about antifungal drugs and the really clever tactics they use to take down one of medicine's most stubborn enemies.
You see, fungi, they're survivors. They literally construct their own defenses, these tough outer layers that work just like armor. So that brings us to the core question of this whole explainer. How do you defeat an enemy that builds its own armor?
So here's our battle plan for today. First, we're going to size up the fungal threat. Then, we'll scout out the enemy's weak spots. After that, we'll look at our two main lines of attack, targeting the cell wall and then the cell membrane. And finally, we'll see how all these tactics play out in the real world with patients. First things first, why does this matter so much? Well, fungal infections are a lot more than just athlete's foot. For patients whose immune systems are compromised, these infections can be absolutely life-threatening. So in those cases, picking the right drug, the right strategy, it's not just important, it's critical. You know, to defeat any enemy, you have to know their weaknesses. And for the fungal cell, our intel points to two main vulnerabilities in its defenses. We're going to target the very structures that give it its shape and its protection. So, weak spot number one is the cell wall. Think of this as the fungus's external armor. It's tough, it's rigid, and its strength depends almost completely on a substance called beta-glucan. Now, remember that name, beta-glucan, because that is our primary target. Okay, so right underneath that armor is the cell membrane. It acts like a gatekeeper, and it's held together by this unique stuff called ergosterol. Now, here's the kicker. Human cells don't use ergosterol. That makes it a perfect, super specific target for our drugs. So just to recap, our two targets are beta-glucan in the wall and ergosterol in the membrane. Now that we've got our targets, let's look at the arsenal. To breach that tough cell wall, we deploy a class of drugs called the echinocandins. You can think of these as the specialists, the demolition crew, designed for one single purpose, to tear down that beta-glucan armor. So how do they actually do it? Well, they're more strategic than just a wrecking ball. They don't just punch a hole in the wall. Instead, they go straight for the factory that builds the wall. They shut down a key enzyme, which stops the production of beta-glucan. And with no beta-glucan, there's no wall, and the fungal cell just falls apart. Pretty clever, right? So how are you going to remember what these drugs are actually for? We've got a really simple mnemonic for you. Candies stop Aspergillus. Let's break that down real quick. The C is for Candida, which is a really common and serious fungal infection. The S is for severe systemic infections, the kind you often see in patients with weakened immune systems. And the A stands for Aspergillus, another dangerous fungus where these drugs are a key line of defense. But of course, every weapon has the potential for some collateral damage. So to remember the side effects of echinocandins, we've got another little phrase for you. Liver's bad, GI's mad, infusion's sad. So liver's bad is your reminder to watch for liver toxicity by checking for elevated liver enzymes. GI's mad points to tummy troubles like nausea and diarrhea. And infusion's sad refers to reactions that can happen during the IV infusion, like a fever or chills. All right, we've covered the cell wall. Now let's pivot and focus on that second weak point, the cell membrane. And our arsenal here includes two different classes of drugs, the allylamines and the azoles. Both of them work by messing with the production of that critical building block, ergosterol. Let's start with the allylamines. And you might actually be familiar with these because they're often the go-to drugs for common superficial infections. You know, the kind you get on your skin and nails. Their mechanism is this awesome 1-2 punch. First, they block an enzyme early in the ergosterol production line, which weakens the membrane. But second, that blockage causes another substance, called squalene, to build up inside the cell. And it turns out, squalene is actually toxic to the fungus. So this shows us their most common uses. We're talking about fungal nail infections, classic athlete's foot, ringworm, and even fungal infections on the scalp. These are the main targets for a drug like terbinafine, which is a really common allylamine. For the side effects, we have a very intense mnemonic to make sure you don't forget them. Liver death, headache, and rash. Yeah, it's a bit dramatic, but I guarantee it'll stick in your mind. The main takeaway here is you've got to monitor for liver toxicity. That's the big one. But you should also be aware of more common side effects like headaches and rashes. And there's a really weird one too, taste disturbance. Some patients say they get a metallic taste or sometimes even lose their sense of taste for a while.
Okay, so the other major class of membrane attackers is the azoles. They also block ergosterol production, but they do it by targeting a different enzyme system, the fungal P450 enzymes. These are super important for the fungus's metabolism, and this group includes a ton of widely used antifungal drugs. Let's quickly compare two of the key players here. On the left, you've got fluconazole. It's a star player because it has excellent penetration into the central nervous system, making it vital for treating something really serious like fungal meningitis. Then on the right, you have itraconazole, which doesn't get into the CNS nearly as well, but it's more selective in its action. This really shows you why choosing the right drug for the right location in the body is so important. Okay, so we've covered the weapons, we've covered the targets. Now let's bring it all together and see how this translates into the real world of clinical practice. How do healthcare professionals actually use all this info to take care of patients safely and effectively? Well, there are 3 absolute, non-negotiable monitoring steps. First, because so many of these drugs can affect the liver, you have to monitor liver function. That's a must. Second, because the liver processes them, you have to watch out for interactions with other drugs. And third, with certain antifungals, assessing kidney function is just as crucial. And this all leads to what we have to teach our patients. They absolutely need to know if they should take their medicine with food, why it's so important to finish the entire course to stop the infection from coming back, and when to avoid alcohol. But most importantly, they have to be taught how to spot the signs of liver toxicity, like their skin turning yellow, and to report it immediately.
So, we'll end with this thought. We have all these incredible strategies to attack the fungal cell's defenses, but fungi are constantly evolving, developing resistance to our best weapons. And that leaves us with a critical question for the future. As the enemy adapts its armor, how will we need to adapt our attack?